and hormones. We're all familiar with testosterone, but do you know the role it plays after puberty?
Well, this Wellness Wednesday, we're taking a look at how lower levels can impact you as an adult. The founder of Direct Care Physicians of Pittsburgh, Dr. Natalie Gentile, joins us now. Hey.
Thanks for having me.
I think this is such an important topic too, because I think that we all know some of the hormones that play a critical role in our adolescence. But let's talk about what testosterone actually does through our entire adulthood.
Yeah, I need a refresher. I don't think I've thought about this since middle school health class.
That's right.
Sure. So we need testosterone. All bodies need it. And we start to see that testosterone level rise, if we're just talking specifically about men, starts to rise in their 20s, 30s, 40s, and then it might start to decline a little bit later in life. And oftentimes those are the patients I'm seeing that are coming in, as a primary care doc with symptoms of that. We need testosterone. We need it for our bone health, for our energy, for hair growth, for a multitude of things, right?
Yeah.
And it's important that we're monitoring it and assessing if people are having symptoms of low testosterone.
Okay. And so what will it look like? How will it present if you have low testosterone? What are the symptoms that you should be aware of?
Sure, so if I have men that are coming in presenting with significant weight gain, low energy, problems with gaining muscle when they're exercising, difficulty with sleep, depression. So I really think head to toe. We have to take a full body assessment. And then you start to key in on what are some of the other things going on in their life that could be affecting that testosterone level, because it's not always that they automatically have a low testosterone. It could be what we call secondary causes of it.
Oh,
so their testosterone might go lower because they've got depression, poor sleep, high cholesterol, high blood pressure. We're playing that game of what came first, chicken or the egg.
Right.
So is there like a male version of menopause, sort of?
Not necessarily. I mean, in some ways, time of life, we do see those things type of, overlap. Women going through menopause maybe in their early 50s, men start to see some of these testosterone symptoms around that time too.
Yeah.
I know there's been a lot of talk about hormone replacement therapy. And for men, I know that there is testosterone available for men to take as a supplement, or if you see your doctor and have it prescribed to you. Does there come an age where it's no longer safe to keep your testosterone levels at the same level?
Right, so the reference range changes. The level that we're targeting does change. And so we're not wanting to get to super high levels in a 65-year-old man as we might have wanted in a man in their 20s who has some type of condition causing low testosterone.
Got it.
And let's also remember our transgender patients, right? So gender-affirming care is for all, and I do it for all patients that need that, right? And desire that. And so those levels in our transgender patients may be a little bit different than in a male assigned at birth.
Got it.
So what can that treatment look like?
Yeah, so you can do it in a lot of different forms. There can be injections, that can be topical. Those are the two main ones that we tend to apply. And we start to really assess how does that fit into somebody's lifestyle and their budget as well.
You have a note here that I think is so very important, because I think if there's a man out there who thinks they have low testosterone and they want more muscle mass and they want to feel
or let's say I'm just paranoid about balding.
Right, or something like that.
Not mentioning any names.
They may want a higher level of testosterone, and unfortunately there are some things that are out on the market that are not FDA regulated that could cause some problems, right?
I mean, we've noticed anytime somebody wants to feel better, kind of wellness industry swoops in and might have things that could be scammy or not FDA approved or safe to do.
Right.
But it's important to know that going to talk with an actual physician, right, or an endocrinologist especially, who can help you with this and do it in an evidence-based way, is the route that I would definitely recommend.
Well, it's also interesting, I feel like in pop culture, we mash testosterone with also sort of being manly or being, assertive or whatever. Do you know the podcast, This American Life?
Yes.
They did this episode where every member of the staff did a test to see what their testosterone levels were.
Oh, so interesting.
And it really and they had the conversations about it afterwards, because it's sort of I think everyone is playing it cool, but then they sort of secretly do want to have more testosterone,
Yeah, and what is this desire to have a higher level of testosterone?
Yeah, so it's it correlates with being an alpha male, or that's not true, right?
Yeah.
It doesn't correlate with your personality necessarily, what your testosterone levels are. But sure, there's this desire for being vibrant, right? There's this desire for lush hair, strong muscles, high energy, high libido. Of course, most people want and desire that. It doesn't mean that testosterone is the key to that for everybody.
Right.
And again, this goes back to getting tested. And I asked you about this before, because women also carry a small amount of testosterone as well. Is that right?
We've all got it here.
We've all got it.
Yeah, absolutely. And when we think about our patients, for example, with polycystic ovarian syndrome or PCOS, extremely common endocrine disorder that women have, they can have higher levels of testosterone that aren't good, right? Like that we don't, it's too high.
Yeah.
It's too high.
Yeah.
Gosh, thanks so much, Natalie. Well, if you're interested in learning more about direct care physicians, Pittsburgh, or Rebel Wellness, we'll have links on our website, kdka.com/talkpittsburgh.
All right, now we're checking in with Kelly, who's looking like she's ready for a workout.
yeah.
Let's see that flex
do
now.
I?
Come on.
Oh my God, I don't want to intimidate anyone. It's all a lot. I don't know if I'm ever ready for a workout, to be honest, but this next segment sounds very promising. After the break, we're going to try out some metabolism boosting workouts to add to your routine with Jordan Rose. Don't go anywhere.